spoken a lot about healthcare today. A lot of us say healthcare is failing. We believe healthcare is changing, and we want to be part of that change. This slide has been up for a good 30 minutes, so I guess I can skip it. By now you should have read our mission and vision statement. So this is where the problem is at currently. I think last week or 2 weeks ago I got my annual email from the medical aid scheme announcing another increase of 8.6%, while inflation is more going towards 3%. So if you look at our hospice-centric model, right, is that we have a high rate of admissions, we have a huge duplication of services, there's some fraud, waste, and abuse as well. Readmissions has been spoken about. It's a massive problem. People go into hospital, go home, go back to hospital. And the actual quality of care is continuously declining, right? And that especially is an issue at the provider at the funder side, is that these costs are just rising out of control while quality is not improving. We believe that healthcare should change. So if you look at the pie chart, maybe a little bit hard to see, but the pie chart basically represents what the medical aid spends their money on, right? And if you then look at that pinkish slice, that is the cost of hospitalization. Now, if we speak about hospitalization, we just talk about nursing care and the beds and the breakfast, right? So a very expensive hotel. So from all the money that the medical aid has available, most of the money goes to people staying in a hospital. So we're not even talking about surgical procedures, we're not talking about dentistry, we're not talking about pathology, it's just the staying in hospital is crazy expensive. Average hospital stay is 42,000 rands and rising. Growing number of hospitalizations that's required, we're getting more older, but as we could see earlier today, our quality of life is not necessarily improving. There's also unintended outcomes with hospital stay. A lot of elderly people suffer from delirium. And obviously there's these antibiotic-resistant infections that like to lurk around in these places. So hospitals are not always the best place to be at. So if you think about a hospital, like what is available in a hospital, right? We need to see what is there. So obviously there's clinical oversight by your treating doctor. You have real-time vital sign monitoring because there's a nurse that comes to you. We have nursing oversight. We have in-person consultations, there's medication available, IV therapy, short-term oxygen, lab services if you need bloods, there's skilled nursing, allied health services like physiotherapy, and rapid response protocols, right? This is basically what the hospital provider offers you if you're in that very expensive bed. But if we want to then bring that to the home, we need to think about how do we do that in a home setting, right? And that's not very different. There's still clinical oversight by a treating doctor. We have real-time vital sign monitoring. We have a 24-hour clinical command center. We do in-person and virtual visits. We deliver medication to your home. We deliver IV therapy. We deliver short-term oxygen. We have laboratory services as well. We do skilled nursing. We work with allied healthcare services. And we have rapid response protocols in place, including EMS services. So basically, we replicated the whole hospital environment into a home setting. So the way we do that is with cutting-edge technology. This is our vital patch. You stick it on your chest. It monitors all the vital signs every minute. So we have near real-time vital sign monitoring. I really like the slide that Richard had of the vital signs being written down on paper. So we've digitized that, and this is what our patient gets on admission. We treat a very broad range of diseases. I'm not a doctor. I want to be, but they don't want to give me that degree. Apparently, it's pretty hard to get. But basically what we're saying is that anything that can be treated in a general ward can be treated at home. That's basically the level where we're at. Obviously, a referring doctor needs to be checking if you're a good candidate for a home setting. If you need ICU level care, you really should still go to a hospital. And surgeries in your living room is also a very bad idea. We have some exclusion and inclusion criteria, but basically what we always like to say is an RDP house is like a perfect environment. You have water, you have electricity. You don't have to have Wi-Fi, you don't have to have data. We take care of all of that. Unfortunately, children are not allowed, and that has more to do with FDA approval and things like that. But this is basically available, or this is a good program for everyday South Africans. The journey is as follows. From a patient point of view, you consult with your doctor. Your doctor knows about Cure Medical and offers this as a good solution for you. We do a pre-authorization if you have medical aid, and then you get admitted, so we will come to your home. You get onboarded on our platform, and you recover from home. So from a patient, it's actually very normal as per any admission would be. From a doctor journey, it's slightly different. You have to sign up with us. We need to know who you are and that you're a real doctor. You then consult and refer patients into our platform. What is really great for doctors is that they can have clinical oversight while their patient is on our platform. They can make notes on the platform. They can write scripts and all of that. And what is really, really great for doctors is that they then get paid by medical aid for having that virtual oversight on our platform. So doctors can now treat people in hospital and out of hospital at the same time, and they actually get paid the same amount from the medical aid. So we really try to create a win-win-win situation. The space that we play in is really acute care. Telemedicine was a word mentioned often. We don't do telemedicine. We really are here, and we also don't do ICU care. We're really here to alleviate general ward and subacute care. So we treat people who are pretty sick. Basically, how we create value in the healthcare system is that we have a couple of ways where you can get. I don't have a pointer. Yeah, there are a couple of ways that you can get into Cure Medical. It can be because of an early hospital discharge, right? So you are in hospital, but we want to get you home as soon as possible, and after 1 or 2 days in hospital, you get discharged to Hospital at Home, our Hospital at Home program, and then you recover with us. You can be directly admitted to Hospital at Home, so instead in alleviation of a general ward admission. Another thing that we have is our transitional care program, which is pretty interesting, where the medical aides actually came to us and say, guys, we have a really big problem. From the data we can see is that there's a group of patients that have all kinds of comorbidities, they have all kinds of issues. They crash land into emergency services, they're in hospital, they go home, and 15 days later they're back in hospital. Can we please build a program around that to really solve for that issue? So our transitional care program is really where you get discharged, and we will call you and say, okay, now you're discharged. What we want to do is we want to look after you for 30 days from your home. So we will look after you for quite a lengthy period, and we're going to do everything to prevent you from being readmitted. And we saw huge improvements and drastic cuts in readmission rates, which is, again, a great win for the medical aid, for the patient, and for the whole healthcare system. We've built an amazing technology platform that is built by me and my team in South Africa that we're very proud of. It's called Cure Medical Insight. Doctors can log in from anywhere. It's web-based, but we also have a mobile app available on Android and iPhone. It's state-of-the-art technology. This is like built on modern cloud solutions, completely secure and scalable. As I said, we have a real-time command center in Bryanston where people are monitoring hundreds of patients 24 hours, 7 days a week. And what you can see basically here is that we have built in an early warning scoring. So we have a range of parameters. And what is really cool, some of you might know, is that, for instance, respiratory rate is one of the leading vital sign parameters that can predict a cardiac attack, a heart attack. So by us monitoring you 24/7, we can actually see how you're doing before you actually notice it. And this is our dashboard, and we basically are managing to monitor a lot of people because we have early warning scores and we have very smart algorithms implemented. If you think about it, you actually don't want to spend a lot of time on patients that are very healthy. You want to focus on the people that are not doing well. That's where you want to put your energy. We have an electronic medical record keeping. Again, it's a great way for multiple doctors to connect and talk to each other through a digital platform. Care is often not done in a silo. There are multidisciplinary teams. You have many doctors. So it's important that everybody can leave their notes. And we create accountability of these nodes. This is an example of a 12-lead ECG. Again, I'm not a doctor, but I've been told that not a few years ago, ECG lead machines are massive. Like, you put them on a cart, you go to a bed. We actually have a 12-lead ECG machine that's about the size of a phone that we take into your house. We do a 12-lead ECG, we upload the results, we make a note, we tag your cardiologist or whoever has to see it, and it's all done in near real time. We also have virtual calls. We liked the idea of being able for the doctor to still see your vital signs while you're consulting with your patients. A lot of elderly people don't really know how to do video calls. For them, we mainly use WhatsApp. We believe we should always try and meet the patients where they're at. Pretty soon we'll be on TikTok probably to do our consultations there. Yeah, our command center is very data-driven and highly efficient, 24/7 operated. At the moment, we even have a licensing opportunity, so we believe that what we've built is pretty unique. It's unique in the country, and we also believe that we can't be the only one leveraging this technology. We're not going to be the company that's going to heal the whole country. So we are really interested to find partners that can work with us and use our platform to basically do the same thing that we're doing in other areas. Our impact is quite big. On the right, these are all our clients. I don't know if the people from Platinum Life are still there. You are missing on the list. Talk to me, do something about that. But we're basically contracted with all the large medical aid schemes. And we're also contracted with a lot of the things that we call government adjacent schemes. So things like GEMS, PolMed. We are actually in the communities quite a lot. This is not some kind of cent and houten solution for the rich and few. If you are with one of these medical aids, we can help you out. We've done over 200 admission dates. We like to count admission days because we have programs and we monitor you for a lot longer, so we think it's a more valuable measurement than just patient numbers. Our patient satisfaction is really high. Yeah, we managed to reduce length of stay in hospitals with quite a bit. It's all about the money, right? So reduction of cost is huge. And this goes for acute hospital care, but also for subacute care. We managed to reduce the cost about threefold. But another interesting thing that we're seeing is that the cost of radiology, pathology, and even the cost to the provider is decreasing. Because we're trying to be a bit smarter about this. Like, if you talk to the pathology providers, you can actually get pathology results for patients for the last 12 months, right? Like, you don't have to do this whole duplication of services. You can actually work together and get access to this data. Patients really love what we do, especially people who are living close to you and living next to you. You don't have to travel to hospitals where there's visiting hours. People really love the way we come into their home, the way we provide care, and the way we help them to get better. We like to collaborate, so we're collaboration with Operation Healing Hands. So Operation Healing Hands is basically surgeons that work in private practices. They are donating their times and skill to alleviate hip replacements and knee replacement for public patients. And they basically came to us and for us to run this fund and this NGO, we basically want to use Cura Medical so we can decrease the cost of these hip replacements and knee replacements. And this way we're helping Operation Healing Hands to reduce the cost and get these people home as soon as possible. We have a very cool and capable leadership team. Dr. Vianney is our CEO and co-founder. He studied, he actually grew up in Kailicha, and he studied at UCT. For his crimes, he went also to Oxford. Zico Pali is another co-founder. She went to WITS and Harvard. Had a brilliant career in lawmaking and decided that she wanted to do something more impactful than making money and screwing people over, because that's what lawyers do, in my vision. No. And Dr. Cyril Nkambinde from UKZN is our Chief Medical Officer. The market is shifting and changing. Discovery is having actually a designated service plan. So we are one of the hospital at home service providers for Discovery. They basically said, if you have one of these 8 conditions, we want to try and make sure you go home instead of going to hospital. GEMS is also endorsing this program. They recently sent out communications to all GEMS connected doctors about Cure Medical and our hospital at home program. There's a growing adoption of schemes, so especially if it's that time to switch and change and save. If you guys are looking for new plans and options, you're probably going to see hospital at home mentioned in the marketing material that the different schemes are bringing out. But this is not alone. Deloitte is still here. Even you guys wrote some kind of report about how hospital care is moving to the home at a global scale, and this is a massive market. Especially at a global level, this is happening everywhere, and I'm really happy to say that we're finally on par with the rest of the world. The NHS is doing hospital at home at some of their hospitals, and they have virtual wards. In Australia, the local and national government are working together to create this market. But India is actually one of the leading nations where millions of people are being treated at their home. So that's really great to see. Another really cool thing is that we've brought the patient to their home, but now we're going to try and bring more services to the home, because it doesn't make sense if you have to then still go into hospital if you need to do an X-ray, for instance. So what you can see on the left is actually a fully fledged X-ray machine. Again, I'm sure most people have done an X-ray in their life. These are massive, super expensive devices. With the evolution of technology, all devices are becoming smaller and more innovative. And this is a fully fledged X-ray machine that's just as good and just as powerful as an X-ray machine in the hospital. It weighs 3.5 kilograms and it's literally portable. You can take it anywhere. On the right is a butterfly probe. So this is basically a fully fledged ultrasound that you can connect to an iPad, and you can do an ultrasound from literally anywhere in the room. We are currently working together with Butterfly to create a course for South African students and doctors to get proper training on this device. Yeah, so I think those were a few messages from our end about how healthcare is changing and how we want to be part of the change. I have one more message for you. My wife is always saying, you're always presenting everywhere, but you never see me. Can I please come and watch? Yes, you can. Thank you for coming, and I couldn't have done it without you.